Hi, my name is Angel Wagner, and this is Dr. Bronson's Planning and Evaluation Fall 2015 Graduate Level Course. Okay, so the program that I chose to evaluate was the relationship between substance abusers and those that are physically violent in a relationship. So, I want to make sure that this program is open to everyone of all different socioeconomic status, race, religion, belief, everyone. So the only thing that is required for this program is 30 days of consecutive sobriety. So to the the method of selection for this program is going to be the survey method, in which I will ask several questions, um, such as their role in the program. Are they the addicted person? Are they the abuser? Are they the abusee? And the people will then be selected at random. I want to make sure that from the beginning to the end of this program, all ethical standards are upheld and that everybody is respected no matter what their role is. So, see, 81% of women actually report physical abuse in a relationship at some point. 69% of men report that at some point in their life being physically and or sexually abused in a relationship. So I want to make sure nobody is judged, and it's very fair. My intention with this program is to find what pushes people to begin these mind altering drugs. Is it the past physical or sexual abuse? Is it watching or growing up in that environment? So, to find out, since we are talking about things of the past, most likely, in a lot of the different cases, I would use therapy, counseling, hypnosis, any means necessary to get these people to push them to the next level, to open up and be open and honest so that we can see results for the program. I do require that, like I said, that you do have to be sober for a number of 30 days because trying to get them sober and maintaining their sobriety will just be too expensive. A regular rehab costs on the downwards ends of $7,000 a month on upward to $130,000 a month. So it would be entirely too expensive to fund everybody's sobriety and to make sure that they maintain their sobriety throughout the program. So you do have to come to the program already sober. And also, because sobriety is something that the individual themselves will have to make that decision, it's a little bit too much pressure on them to begin sobriety in a program. So we do want to make sure that they're successful already in their sobriety. So that is why that is required. I want to make sure that they're able to ask questions, to learn, that it's a very open process. It is an illness, so it will be treated as such in the program. I do need their full cooperation so that they are able to, on both ends, the substance abuser is able to recover from this illness of being dependent on mind-altering drugs and or alcohol, and the abusee is able to exit this cycle of violence with a partner because it can become very tumultuous and a repeated cycle, as we know. So the the way that I cut the cost down, as I said, was by making sure that they're already sober. They will be in a remote location away from all outside influences so that we don't have to worry about their sobriety through the program. And we're just going to ask several questions on what pushed them to it and what we can do better. Some of the resources that I used are substance abusers and the domestic assault of women. Integrated treatment for dual disorders, a guide to effective practice, program evaluation methods and case studies. I think that's about it. Thank you.